Let me go ahead and start. Okay. Awesome. Welcome to the Emergence Podcast, an evolving inquiry into the human mind and spirit. We explore what happens where art meets humanity and science meets quantum possibility. I'm Alice, joined by my co-host Mark. We welcome our guest, Dr. Tafur, who demonstrates the value of spiritual healing in modern healthcare. So first question today, Dr. Tafur, is a lot of your work centers around psychedelics. You even wrote a book called Medicine Song. What inspired you about your journey? That's what I wanted to know.
Oh, okay. Well, I have another book too called Fellowship of the River. It's kind of about that. It's about the
Ah,
journey and yeah, it's the prior book. And I got him. I am involved now in psychedelic assisted therapy work, but I spent a long time more deeply involved with sacred plant medicine in more traditional sense in Peru. And I got involved because in medical school I got depressed and I was struggling and trying to find help and I found help in Arizona where I'm from. Sorry.
Donna.
Um yeah, it kind of really made a big difference for me. It kind of helped me get through my training, and so I became very interested in plant medicine, sacred plant medicine, and the possibilities. And my family is from Colombia, South America, where they
Awesome.
have the tradition. Yeah, so I knew about the plant medicine tradition in South America. And since I was responding so well to the peyote ceremony, I thought, what would that be like? So I went down there and I had a really big experience. Started getting involved and became friends with the healers there, and we started our own healing center. You know, I lived down in Peru for a while, so that was the main. When I got back to spend more time in the States again, I was still very involved with sacred plant medicine. And then just as a doctor, started getting to know, being invited as a person that was working with ayahuasca and plant medicine to the conferences and starting to have more exchange with the psychedelic therapists and learning about the kind of intersection between those two fields of the ceremonial approach and the therapy.
Mark, you have a question?
Yeah, sure. And thank you very much for coming. And we're so interested in talking with you. And because it's really a journey towards self-discovery, and we're just going to discover what we already know and maybe some other stuff about ourselves. And I took a look at the picture behind where you're sitting, and there's a lot of symbols in that picture. There's a lot of like archetypal stuff, is archetypal stuff. And so I'm going to read you a few things, and it's just really from one of the interviews you had. And I want you to, if you don't mind, just comment on if you think there's some symbolism here.
Uh-huh.
So you were born in Kansas.
Yes.
Anything there?
Anything there? I was born in Kansas. My parents were immigrants from Colombia, and my father was doing his residency in psychiatry there, and at a program, the Menninger program, psychiatric program, which was a lot more kind of spiritually focused, spiritually open. And so there's that, and then just being born in the middle of United States to kind of, I don't know, have my role of trying to bridge worlds with the Colombian background, but be born in the heartland. So that's
Yeah.
kind of
Yeah.
curious. Yeah.
So it's like, it's a spiritual thing. And, just for lack of a better, we've got the Wizard of Oz, which of course has to do with Kansas. Father's a psychiatrist from Colombia. As a child, you were into science, biology, and service. What did you mean by service?
I mean, child, I don't know where I said that exactly, but service, I mean that like as a spiritual path or a spiritual work that from early on I grew up in a religious background and just through school and little leadership type workshops doing things where you're doing community service for the community.
Mhm.
And so being interested in working with the community. And so when I went to college, then I got very involved in a summer camp that was for kids that are below the poverty level and taking them into the woods, and became kind of involved in the leadership there of that organization. And then afterwards, I became eventually a doctor, a medical doctor, So working with the community, serving the community, I think that's what I meant, but also that the I don't know, maybe the wisdom or the gifts that come from that. I was intrigued by that and the spirituality of that.
It certainly sounds like you come from, a priestly line or, lines of helpers like educators and doctors and this sort of thing.
Yes.
So you found yourself depressed to some degree. You didn't want to, but you tried conventional medication, which you said helped, but something about it didn't resonate. You began to learn about other things, Chinese acupuncture, holistic culture, sacred plants, went through a ceremony in the Church of God in Arizona using peyote. Can you tell us just a little about that?
Yeah. It's just there's a place here in Arizona that is kind of open to the peyote is very kind of sacred plant medicine that in North America is a scarce resource that a lot of the tribes have asked people to stay away from to protect the wild population for the traditional use. And so I support that. And the Peyote Way Church of God in Arizona is a place that cultivates their own peyote so as not to disturb the wild population. And they, oh, sorry, got this throat problem.
Just take your time.
Thank you. They have a ceremony, a spirit walk ceremony that's open to people to go through a process to get screened in and have the experience. And that ceremony is an all-night ceremony, ideally alone with the peyote cactus after being on their property and tuning in. And I had a big reconnect. I felt that the medical school training was, I don't know, really challenged me at a level that it was just really driving out any kind of spiritual connection. That's why I really felt that. And I really felt that was the culture and the environment. And it was very disturbing to me at the time.
Right.
So going to the peyote ceremony it just reopened me to that so rapidly. I was very surprised. Yeah.
Great. I think I understand that so well because I went through medical school too. And I think I had the exact same experience and felt that there was something that was lacking there. And,
yeah.
And that, so I do totally understand that. Now, when you did enter medical school, you said that your curiosity about this lingered enough to ask why they weren't talking about different kinds and methods of healing. Then you trained and graduated in family medicine like I did. Because of familial memories and connections to shaman tribal leaders in the Amazon rainforest, this lingering curiosity took you back to Peru, etc. So what I want to talk about is this journey, and it's almost as though, like I can only really speak about myself, but I was compelled to do more. That like I got this training. And this is good, and it's going to help me in helping a patient, making differential diagnosis, etc. But it's only part of it. And there's another half, and that's understanding their subjectivity. And what connects these is really the fact that we're spirit.
Spiritual beings.
Let me leave it over to you. I've been talking way too much. You go on. You take.
I would say spiritual beings, right? We're spiritual beings on this planet, which is a different kind of understanding than being physical beings in this body.
Mm-hmm. I attended this conference just recently about near-death experiences, and like psychedelics and dreams and other what I'm going to call altered states, you can access stuff in those modes which you can't normally access in conscious awareness. What would you agree with that? What's your experience with that?
Yeah, that's my personal experience with that, and I think it's widely reported phenomenon, right? That it's It's not just one person, and we hear about this a lot. And so I think it's one of the, mysteries, or pointing to this mystery. And I think that, I think there is a spirituality to our being. I don't know that like, one thing I would like to say, like, closer to some of the native understanding, is that it's not so much like separated from that, that it's like we're just happen to be in bodies, but it's kind of in a continuum, that there's this physicality, and there is a spirituality, and they are, deeply interrelated. And that in the physicality, and that there's tendencies to maybe to disconnect, or not be so in touch with this maybe spiritual, invisible, or other hyperdimensional, I would call it, energies or spaces or places. But that we do hear many reports of people having near death experiences and experiencing transcendent experiences, I guess you could say. And so for me, definitely, I had a very what felt like a very supernatural experience, during a car accident, and as a teenager I got ejected from a rolling car. And
So did I.
yeah, did you? Yeah.
Weird.
Hey, Mark, I learned something new.
Weird coincidence. Go ahead, tell us about what happened.
Well, I mean, I think that it just, in my case, I definitely thought I was dying. I thought I had the experience of feeling like this is it. Like, my body's not going to be able to take this, and everything slowed down. And I kind of slipped out of into some other realm. I felt myself in a spiritual consciousness, and that was just a very peaceful state. It wasn't like I didn't advance or learn anything so different. It was just extremely peaceful. But I also felt myself in touch with that, and that disembodied spirituality. And so I came back from that experience, and I woke up on the asphalt, and I was in a very altered state physically. I was in some kind of shock, or whatever you want to call it, but I was not in any pain.
Mm.
And I stood up, and I was helping, to deal with a few things. And then it wasn't until later, that after we made some phone calls and did some things, that somebody was like, "Hey, you need to, you should go clean yourself up." And I was like, what are you talking about? And just seeing the look on their face, and going to the bathroom, and just seeing myself, bloody and broken and injured, and just kind of shocked. And then the pain and everything starts, and I was taken away in a helicopter from that scene. So it was a strong experience. Yeah.
Right. And did you have some internal injuries, or?
Not too many. I had a broken collarbone, and we were very miraculously I did okay, and my friends came through it all right. There were 3 people ejected, and everyone survived, and had some serious injuries, but were able to recover. And in my case, it was just gashes and
Wow.
a broken bone.
Mm-hmm.
I have a question.
Obviously.
Sorry,
go ahead.
Actually, I have a question for you. And as I'm hearing you speak about spirituality and how it's an integral part in your life, why do you think people get uncomfortable around spirituality, or when they have to talk about it? I have seen that in my experience, that you either have people that understand spirituality and there's some sort of alignment when you have a conversation, or they're uncomfortable. Why is that so in your experience?
Yeah. I think you see a lot of there's a lot of in America, for example, just to speak to this culture, where I think it's more uncomfortable for people than some other cultures. Like, my family's Colombian. I don't think it's that uncomfortable of a topic in Colombia. But here, there's a lot of religious trauma, number one, that people are very triggered by. Religious, kind of like their spirit, they associate spirituality with their religious experience, and their religious experience often is something that was filled with judgment or even abusive behavior.
Mm-hmm.
And so they just see that as like, no, thank you, don't bring that up. I don't,
Mm-hmm.
that's a dark road. They have that feeling. And then there's other people that I think that the reality is that to be in touch with this subjectivity, that Mark talked about, and to be open to these altered states, or it's through our emotional being and a very vulnerable part of ourselves that we become aware of that. And so a lot of people have not been held in a safe place for them to be vulnerable, and so they avoid the vulnerability that opens. It's not, they're uncomfortable with that. They haven't been supported adequately to experience that, to process what's in the way of what they're feeling inside.
Does that mean with your experience with spirituality, you're able to hold your patient a lot more than before your experiences? What
Well,
has
I think
changed?
yes. I mean, I think there's definitely like growing body of evidence. And something, there's different practices and different thoughts, but one example is I've seen some publications around mindfulness and showing that, mindfulness practice is improving the emotional intelligence of the clinician.
Mm-hmm.
And so with an improved emotional intelligence, the reality is, if the human being, that's part of our apparatus, is to sense these things, subjectively through our consciousness, through our spirituality, through our emotion, then that's a really big advantage over, any machine. I mean, the machines, of course, are very helpful, and the artificial intelligence, and you're going to gain a lot of, information from that. But to not utilize the full apparatus of the human machine, you're going to really miss out. And that if you were able to improve your emotional intelligence and your sensitivity, and you try to raise your consciousness, I think it would be very logical that you would be a more effective physician and understanding more rapidly what the nature of the problem is.
Absolutely. That was very well said. And I think that I did a lot of work in addiction medicine, and it can be a very scary area. The behavior is often very chaotic and unpredictable. And I've been in obviously very, strange and potentially dangerous situations. However, I never once felt worried, scared. And the reason for that was I felt that each individual patient knew I was there for them, knew that I was helping them. Even though they didn't like sometimes the things I said, they knew I had their back.
Yeah, I think that's, there's a faith that comes with an intention that's as conscious as you can be. You're trying your best to really come from a very holistic place and a conscious place where there's a lot of, if you what we were just talking about, if you're not really coherent, and you're what you're bringing to the situation,
Yeah.
something like they like the equine therapy. The equine therapy is about that, right? That the horse or the animal, the biology, if you bring some kind of expression to the animal that's not coherent to what's the biology of your body, that they can tell there's some intention that's mixed, that
Horses
you're not
can
totally,
tell.
yeah, horse and people, a lot of people can tell too, and dogs, and all kinds of most of the animals, and maybe the plants, and it's just something it's available to us.
Cross
And
frequencies.
yeah, it's part of survival, that you would be able to sense that somebody's giving you like mixed signals, and there's different degrees of people that could try to hide that and all that kind of stuff. But the addict, let's say, for example, that is pushed themselves into so many states, altered states, and is in some ways broken open different levels of honesty, within themselves and their sensibility,
Mhm.
that they really, that they would require that somebody's coming at them in a holistic way, in this coherent way, and hopefully, that gets through to people, and that would be kind of like love, that they actually can appreciate. Okay, this person actually is bringing me love in my life, and that's a nourishing thing. And so, how do you demonstrate that? How do you build that trust? It's a faithful process, right? For people to go in, like you said, this priestly line, or to go into these, to talk to the murderer or talk to this person or talk to that person, obviously more extreme example versus, somebody just exploring or having a problem with substance. But to be able to go to these very difficult places with people, means like you have to be willing to go there yourself. That's what they say in the psychedelic assisted therapy world, for example. You can only take somebody as far as you're willing to go. So that's part of that coherence too, is that honesty about, your own insecurities, your own pain, your own issues, that you have compassion for another person and they can hopefully sense that from you.
Yes. My feeling is that when you're dealing with, some severe psychopathology or whatever you want to call it, at end, we're dealing with subjectivity. We're dealing with something we don't know anything about, somebody else, the other mind. We don't know anything about it. And the only thing we do know is that there's distress, there's despair, and in some way, dishonesty, in the sense that the patient doesn't like or love himself or herself. And this is the source of the problem.
Yeah, no, that's true. And so I think it's the gentle process of, helping somebody to love themselves. And that is, was an interesting thing about what we were talking about earlier, of this kind of spiritual aspect of us and who we are as human beings, is that some of those answers maybe require that they're found. We were just hanging out with the Rainer retreat with one of my friends who's a Navajo medicine woman. And she was saying, the peace, the love, the gratitude that people seek, that's really like, it's on a spiritual level, dimension, that you would need to invoke, engage this mystery to be able to experience that.
And receive it. So you embody it to receive it.
You embody it. And so then to be able to embody it, you have to open yourself to that. And so there's something there as far as finding contexts that are going to help you love yourself, and find that self-love through the reflection of some kind of, unconditional love that you may encounter beyond yourself. Either that could be a person, it could be a therapist, it could be a spiritual relationship, and so many other influences. But within yourself, you may struggle to find it without that support.
Yeah.
Given the circumstances of your life.
Support is important. Mark, do you have any other questions? Because I got a final question.
Oh yeah, I've got lots of questions. I'll just have to find one.
You got one more.
Okay. I want to talk about. Yeah. Okay. I want to talk about Timothy Leary just for a minute. You probably know him well. He had his PhD in chemistry and wrote a number of books, including The Politics of Ecstasy, which was particularly interesting because his idea was the first I've ever heard of expressing it in terms of DNA, in terms of DNA expression. Like when you take psychedelics, the way psychedelics work is they're destructive. They destroy ego. They dissolve it. And what you're left with is memories of you in the past, or if you believe it, past generations, past lives. And you can actually see yourself, in past lives doing things, and you can see your family, and you can see yourself as an animal and as an insect and as an ant, all the way back to the beginning. I'd never heard of this actually said in the way that he said it. Do you believe this? Do you think that genetics actually shows us?
I think that, well, first of all, I think he's a clinical psychologist, Timothy Leary. Like, I don't think he's not a chemistry guy. So then, but as far as I know, but I mean, he's a very intelligent guy, no question, and had his experiences and his things. And I think, like, I think that the biology, the epigenetics or the genetics, all that stuff, and now the epigenetics, right? The nature versus nurture, that you have a part of you that's like within the genetic framework that is responding to the lifespan that can be transmitted across generations, and that's flexible, and it's this versatile part of it is all there. And then that there's this kind of, I put it in the first book, Fellowship of the River, like just this idea. It was from a dumb kind of vampire movie that I saw where they were trying to, these vampires had created these planets that were just generating all these people that they were trying to get this same genetic code to reappear so that their great grandmother vampire could reincarnate, that they needed the right code to receive this particular soul, like that was a part of it. And I thought that was kind of interesting, that there does have to be kind of the right conditions for a certain kind of life to be embodied. And so
the difficulty is, from what I gather, is methodology, right? You're looking for the method of synchronizing lives.
Synchronizing.
Yeah, I don't know. I mean, there's a lot of room for, like, there's so many things we don't understand about that, right? Going back hundreds, thousands of years, millions of years, and all that kind of stuff. I don't know. So I think that there may be something to that. I think that there is something to honor in the relationship with the flesh, with the earthly, aspects of the embodiment of the spirit that I think are important and relevant. And in that sense, it's not just like this illusion of this world to discard, but that it's part of it, and that caring for the earth is part of that celebration.
Absolutely. Sorry about the sirens in the background. What's next for you? What do you have planned moving forward for this year in your work and in your personal life?
I am trying to promote the book Medicine Song. I'm traveling around a little bit. I'm going to Berkeley next week, and so just traveling around to promote the book. We have retreats. I still take retreats down to Colombia, and in late July and August, going to retreat in June to Peru. So still bringing people down to have experiences down there with my friends and colleagues there. And then we're going to start a clinic here in Phoenix. We're working on it. We have a potential location right now that we would do some psychedelic assisted therapy and with ketamine primarily, but then also bringing in a lot of the ancestral practices and the spirituality into, hopefully, to inform that work.
Yeah, I actually lived in Phoenix.
Oh, sorry. I was just going to say that integration is the big topic now with psychedelics. Yes. It seems like that's where you're headed.
Yes. You live in Phoenix, Alice?
Yeah. I spent a couple of years in Phoenix. I have friends in the healing community. One has an IV clinic, and I actually worked with a gentleman, Ray Speth, who was working on electromagnetic therapy. So ioscope, acuscope, this was equipment from Russia, and it has helped me heal with a lot of some body issues that I had, body pain. So it's Arizona and Phoenix is a great community there to experience alternative healing.
Yeah, it does seem to attract that. It's interesting. It's a funny place out here in the desert, but it does seem to attract that kind of energy. So there's a lot of healers, and the University of Arizona has a Center for Integrative Medicine that I'm affiliated with and work with in Tucson. And there's a lot of native, culture here in Arizona, and the traditional ancestral culture is still alive here. And so there are access points to that, to learn about that culture where spirituality and healing are basically considered to be part of the same thing.
Of course. Well, thank you so much for joining us today, Dr. Tafur. It's been a pleasure. And we just want to close off that the Emergence Podcast welcomes voices from across various fields who offer new insights into what it means to evolve consciously and awaken to our entangled quantum world. So thank you for joining us again. We will be posting all the information on YouTube, and you'll send us some links, and we hope to connect with you soon.
Thank you very much.
Yeah, thank you both. Mark and Alice, thank you for having me.
And we'll be
Have a good
speaking
luck.
again.
Thank you. You
Have
too.
a good day.
Thank you.